I was aware that some doctors were writing to patients quite a long time ago, but it's not something that I had thought about doing myself until I actually recently was a patient myself. I had an encounter with specialists in a hospital outside of this trust. I wasn't given sufficient information in a way that I could understand, and it was really at that point that I reached out to find out more about writing letters directly to patients, so that perhaps my patients didn't have to go through the experience of having that uncertainty about their diagnosis, their prognosis and their treatment plan. I also thought that it would be a good idea to read and embrace the published guidance from the Medical Royal Colleges on how to write to patients in plain English. I look at the PRSB webpage, in which the headings and the content of the letters are there to guide the clinicians as to what to include within the letters.
My name's Lesley and I'm being treated for renal failure, and I come into here 3 times a week to have dialysis. Often I need to discuss my situation, which Ian does on a regular basis. However, he follows up with a letter which doesn't have any jargon in it or anything, and it's really easy to follow. Anything that you've discussed at that appointment, any changes to your treatment, it's all in the letter, but written in a way that it's very personable to me.
In the last year or two, there's been a huge change. The letters are written for patients. The last clinic I had here was with Dr. Logan, and his letter was a breath of fresh air to what you normally see. It was like getting a letter off a friend, somebody you knew.
Having letters that have been written directly to the patient really gives us a sense of what they understand or what has been discussed with them, and it gives us a good starting point to know where to then take that conversation. When we have a referral from Ian, it is very clear what he has discussed with him, because he's actually said, I have discussed, rather than a generic umbrella term, renal replacement therapy. He'll actually say, we discussed dialysis today.
The letters go out, the patients can understand them. They can understand the terminology better, which means that we don't get as many phone calls through. And when they do phone, we've got the information readily available to give out to them. Tests or anything that they need done just does make it a lot easier for us all.
Give me a second, I'll just have a look for you. All right.
I feel involved in my care, very much involved in my care.
It's kind of reassuring as well, because there's no horrible adjectives in. I think, I wonder what that means, and that looks like something I've never heard of before.
It makes perfect sense to write to the patient. They really feel included in the decision making, and that their views are really important, which it really should be all about the patient.
The NHS sends out about 5 million outpatient clinic letters per month. If I was to explain to a patient in clinic how they could check their blood pressure accurately at home, record that information, then that empowers the patient to understand more about their condition and will inform them as to when they do need to come back or when they don't need to come back to clinic. So theoretically, we could reduce the number of outpatient clinic appointments if we were to write to patients in plain English in a way that they could understand. What I would say to my colleagues is, think about if you were a patient and you were coming to the hospital to see a specialist. What information would you want about your condition? What would you want to know about your long-term outlook? And what would you want to know about how you can help to manage that condition yourself?